Welcome and thank you for tuning in. You're listening to the Beyond 50 radio program. I'm your host, Daniel Davis. Well, here we are at the end of the year. President Obama has finally finished his first part of his term in office. And what's going on? We seem to be shifting all of our concern over to the war in Afghanistan, but the big question really looms is, what happened to the promises about health care? They just seem to have dissipated into the wind. More and more people are getting frustrated at the rising cost of not only health care but health insurance all at the same time. We seem to be the most expensive place on the planet for people just to go in with a simple cut to walk out of the emergency room with a bill of $275 to $300. From a simple cut they probably could have just bandaged up themselves. So how come they keep carrying on this big debate in Congress? Here's what I believe, just personally, and it's not that I'm biased or unbiased about what's going on in government, not that I'm carrying the Republican or the Democrat side, but it's simply this. Politicians just seem to love wasting time and taxpayer money and great debates and red tape and bureaucracy. Joining us here on the Beyond 50 radio program today is a wonderful pair of people that are going to be sharing with us the other side of the coin. This is the real side of the coin, the way that doctors see this thing here. And apparently, as I understand here, there's a wonderful website out there simply titled Mad as Hell Doctors, so we can find out more about what's going on, so you can see that it's really the political side that's towing our chain and jerking it, probably for lack of a better word. Our first guest, after receiving his bachelor's and master's degree in electrical engineering from MIT and graduating from UC San Diego School of Medicine, he's practiced for the last 3 decades, and along the way has been president of Mary's Peak Emergency Physicians EMS, supervising physicians for Corvallis Fire Department, and is currently chairman of the Peer Review Committee at Good Samaritan Regional Medical Center. That is our guest today who is joining us, and that is Dr. Paul Hochfield. And we are also joined with Katie Robbins, who graduated from Kent State University and worked in social services in rural Ohio before stepping into the role as national organizer for Health Care Now. She is also a firm believer in the right to health care without financial barriers, and I think we all feel the same way. And I'd like to welcome both of our guests here to the Beyond 50 radio program, Dr. Paul Hochfield and Katie Robbins. And thank you both for joining us here on the Beyond 50 radio program today.
That's really a pleasure.
You bet. Now, geez, here's a different perspective. First, it's politicians lobbying and getting mad. That's all you seem to hear about in the news is what they think. But you never hear the side that really, to me, and I think to a lot of us, is the most important, and that is the side of the people who are actually treating the people who go to the doctor. Tell us about this. And either one of you, go ahead and take the ball.
Well, I'm an emergency physician, and I can't really claim to be speaking for all doctors, but I think I can speak fairly clearly for most primary care physicians and us emergency doctors that are in the trenches, is that, as you said, our healthcare system is just completely broken, and we're spending an awful lot of money on activities that have nothing to do with producing a high-quality health care. There's a lot of reasons why healthcare costs so much, but at the heart of the problem is that we don't have a system, and to the extent that we have a system, it's designed to serve the insurance industry, and we waste 20-30% of all of our healthcare dollars on activities that are basically people fighting about money and people making profits off of other people trying to provide high-quality health care, and that would be the insurance industry. And it's really the fiscally conservative thing to do to embrace something that resembles single-payer or publicly financed health care, whatever you want to call it, because we can take that 20% savings right off the top and use it to actually care for people instead of caring for insurance companies. Currently, 45,000 people die every year in this country because of perceived or real financial barriers to health care. They don't get the care that they need when they need it, and by the time they get it, it's too late, and they end up dying. And they end up dying at great expense to the rest of us who are paying for it anyway.
Mm-hmm. And what are your thoughts on that, Katie?
Well, I would just add that it's clear that from polling, the majority of people favor a publicly funded system, Medicare for all, single payer. The polls reflect different phrasing, but the national debate has tried to shift the conversation to make it seem like people really like their insurance. Most people like the private insurance that they have and don't want to lose it. And I would argue people like their doctor and their hospital, and they want to be able to access that doctor and hospital when they need it. The only way to have free choice, the real choice of provider, is to go to a Medicare for all system. And so it's been incredibly frustrating to see the national debate skewed to protect basically the business model of the private insurance companies, as well as the pharmaceutical companies who are allowed to charge outrageous amounts for the drugs they produce in this country because we don't use the nation's bargaining power to reduce cost. Like in other industrialized countries that have national health care systems. So from our perspective, we continue to remind our elected officials as well as the public that the majority of people, of physicians, of nurses, want to have a Medicare for all single-payer-like system, and it's because of the special interests that are able to influence the debate that we're not able to see this enacted. I'll just remind your listeners that the private insurance industry spent $1.4 million a day lobbying for reform that protects their interests. And unfortunately, those are the interests of for-profit insurance providers as opposed to bettering the health outcomes of the American people or making sure that American people can get the care they need when they need it.
Mm-hmm. I'm reminded.
If I can just add, Katie alluded to the fact that people like their insurance because they don't really like their insurance, but they like their doctor. But I think what people like is they like being able to go to bed at night, not worrying about how they're going to pay for unexpected illness or injury.
Mm-hmm.
And these large number of people that President Obama says, if you like what you have, you can keep it, they don't really have what they think they have. That when they, in this current non-system, when they get sick, they quickly learn that their insurance company is not there for them. They quickly learn that their insurance company can use all sorts of strategies to cancel their policies. And so these people don't have what they think they have in any way. And of the over half of the bankruptcies that occur in this country because of health care costs, the majority of those people had insurance at the time they got sick. So it's really an illusion that this system is working for the people, even that have insurance.
Well, what's incredible, too, is when you take a look at the average cost for a family, let's just say it's a family of four, I believe it's right around $600 a month for insurance premiums. Please correct me if I'm wrong on that, but I think it's about that on the national average. Just imagine if you can afford to out-of-pocket that kind of money for your family, what if you just paid your doctor directly?
Well, indeed, that's what we're proposing is cutting out the middleman that siphons off the needed resources. And people are paying much more than they need to for insurance coverage that doesn't really cover them. In a progressively financed system like Medicare for All, we propose a tax financing structure that would be an increase of 3.3% for the average person, and then that would guarantee all the needed care from womb to tomb, from birth to death. And this is what we see in other industrialized countries. We don't have to reinvent the wheel, but unfortunately, there's a lot of misinformation out there that prevents people from seeing the big picture.
Answering your question, it would work for people to pay for, if people paid their doctors directly, and we let market forces maybe work on this a little bit. At some level, that may solve the problem, but it's not that simple in healthcare. And the reason it's not that simple in healthcare is two reasons. One is that you still need insurance. You still need some backup to cover disasters, cancer, bad injury, needing a heart bypass operation, these things that nobody in this country can pay for out of pocket except for the very elite. And then the other part that's really unique about healthcare that's not like selling widgets is that we're all paying for everybody anyway. And that's really critical. Right now, 60% of all of our healthcare dollars is already directly or indirectly funded through, passing through the government. And when somebody doesn't get access to the care that they need when they need it, and they end up getting really sick and end up in my emergency room, we end up taking care of them regardless of whether anybody can pay for it. Mm-hmm. And if they're sicker than they should be because they didn't go to the doctor because they couldn't pay the $50 or $100 to see that physician, and they end up in the ICU with a bill of $100,000, well, they don't have it, so we all end up paying for it anyway because hospitals charge more because they've got to get those costs fixed. So the trying to use just sort of the free market to solve this problem it's just not like other industries, and that's a really important thing that people need to understand.
Mm-hmm. Now, let's talk about, as the Obama campaign was in motion last year, what the proposal was and how that's looking now when it comes to single-payer health care.
Paul, would you like to take that? Oh, well, yeah, sure. The proposal, the campaign that President Obama ran was pretty simplistic. I mean, he talked about, well, to start from the beginning, in 2003, President Obama was advocating for a single-payer. He was elected into the Senate on a single-payer platform. But running for president, he had a campaign that promoted it. He did talk about universal health care at that time. We're very far from that. He talked about the idea of the public option and also the idea that parents should be mandated to provide health insurance for their children. And I believe the idea of the exchange where you could buy private insurance was promoted at that time. Currently, the reform that is being run out of the Senate, if you've been reading about this, the public option is supposedly dead. Again, it's been declared dead many times over the course of this year. And as single-payer advocates, we always recognize that even with a public option, the reform would be largely inadequate for solving this healthcare crisis in our country. However, they're now talking about the idea of expanding Medicare to people who are 55, allowing people from 55 to 64 to buy into Medicare, which at first sounds like maybe that's not such a bad deal, but we're learning more and more about the proposal, and it's looking like it won't benefit people in that age range as much, and it's also a way for the private insurance companies to allow to not have to cover the people who are high health care risks. People from 55 to 64 have, because of they're getting older, have higher health care needs, and the insurance companies can figure out ways not to have to provide coverage so as not to have to pay for that care. And in addition, we're seeing the mandate for all people to be covered by private insurance if they are not eligible for a public plan such as Medicaid or Medicare. So the mandate is going to, I believe, is at the crux of this reform. The insurance industry has been going along with the idea of reform as long as they were able to have, potentially 50 million new customers.
Well, of course. Let's herd the cattle into
And unfortunately, it's a very regressive way to provide people with health insurance coverage. The state of Massachusetts has had the mandate model in place for a few years now, and it's not universal, though they claim they have 97% of people covered. It's probably not that high. In addition, the people who are purchasing insurance are still going bankrupt because of medical costs in the state. And if you are uninsured, then you're fined. There's a penalty that is enforced through their state tax system for people who are uninsured. So if you're uninsured because you can't afford insurance, then then you're required to pay a fine at the end of the year. It's incredibly regressive, and we argue that the reason why people aren't insured is because they can't afford it to begin with. So it's just not solving the problem.
Yeah, it's almost though. Go ahead.
The problem is it costs too much. And there's a lot of reasons why healthcare costs so much in this country, and physicians are a lot bigger part of the problem than most people can even imagine, but I think that's a little beyond the scope of this discussion. But if you just step back from this not very far, it's almost laughable that this is a bit of a reiteration, but we're wasting 20% of all of our healthcare dollars on the for-profit private insurance industry. And this is what we get for it. The insurance industry, it gets most of its well-paying customers through employment. Well, it turns out that employed people are healthy people for the most part.
Sure.
And then the insurance companies refuse to cover people that aren't getting it through the workplace, that aren't sick, or that are sick. So they're covering the healthy people that don't get it through their employers. They're covering the employed people who, for the most part, are healthy. And all of the other people, which includes old people and sick people and poor people, who are all at great risk of increased health care costs, you know who's paying for their health care?
Yeah.
The taxpayer.
Right.
And it gets worse because these employed healthy people that are getting insurance from their employer, their employers get tax deductions for the cost of the health insurance. So that the insurance companies are getting subsidized to take care of the healthiest people, and the taxpayer is paying for all the sick and old people. That's the problem. And what's being proposed in Congress right now is not fixing that. The exchange and the public plan option that they're talking about, doesn't even exist anymore, that was going to be a dumping ground for all the sickest, oldest people. And it was going to be subject to adverse selection. And the way insurance companies make money is by avoiding risk. And all the risk was going to be put in the public option. And I think that's what Katie was alluding to by the Medicare, dropping Medicare to age 55. The problem with that is that if you get insurance from your employer, you won't be eligible to join Medicare at age 55 or 56. So that it's the unemployed older people that are more likely to be sick that will be eligible to go into this expanded Medicare. And so it's a bit of a trap, just like the public plan option is a trap if it's not designed very carefully. Unfortunately, it is going to be designed very carefully, but it's being designed by the insurance industry using the lobbyists in Washington.
Well, it sounds to me like, from what I've been actually reading and what you're telling me here, is one of the biggest barriers to healthcare reform seems to be politics, people that are already being well taken care of in the first place.
Yes, it's like corporate welfare for the insurance companies. The idea that our taxpayer dollars are going to subsidize the model that they implement is really disgusting. The fact that there will be, subsidies going to the insurance companies so that people can afford their product, which doesn't guarantee that they're protected from financial bankruptcy, or that they're guaranteed health care that they need when they need it, is wrong. They, unfortunately, the national discussion has not called the insurance companies out enough on their practices. And what we know is that they're very good at, like Paul said, avoiding risk. So while certain practices that they implement are illegal, and if the current national reform goes through, and things like, the little breadcrumbs that they're throwing at the American people, that insurance companies will no longer be able to charge women more than men, or that they will no longer be able to rescind coverage once you get sick. The most egregious tactics are supposedly being reformed, but it's really hard to believe that the insurance companies are going to go along with it.
Mm-hmm.
And there's no language in this bill that limits their rates either. So that when they're forced to continue covering people, even when they get sick, their strategy for dealing with that is going to be to raise rates so they can sustain their profits.
Now, here's what's interesting. As the Obama administration was running for office and started moving toward the big debate, which didn't seem to really be there, about single-payer health care, all of a sudden the Republican side were screaming socialist. You're trying to create a socialist government. And then what was interesting about that is how you started hearing countries, outside of the United States saying, what are you doing making fun of us? We've been doing this for a lot of years, and we're pretty happy about the way things are going. What is different between, what we're doing and what other countries are doing in other countries, for instance?
Well, I would recommend T.R. Reid's book, Sick Around the World. Actually, The Healing of America is the book to everybody. It really addresses a lot of this. The main difference is that in basically the entire rest of the developed world, they start the healthcare discussion with access to basic, essential healthcare is a human right. And in that it's a human right, it's a legitimate function of government to make sure that everybody gets it. And that it's just not right for insurance companies to profit as a middleman in helping the government make sure that everybody has insurance. Everybody has access to health care. And the irony is that if you start the discussion with access to essential health care as a human right, you end up being able to provide it at half the cost, and you get better results. This uniquely American solution is uniquely failing us. The rest of the world,
that's the truth?
The rest of the world is doing a much better job. Now, are they having issues with cost? Oh, yeah, they've got problems with cost because of the advances in technology and patient expectations and older populations. They've got issues with cost, but they're dealing with them at a level that's different than we are, and they're asking questions like, how do we get the most health for our healthcare dollars?
What's interesting about that, if I may go ahead and quickly add, too, is through the 6 years we've been doing our program, what I found fascinating, for instance, Europe and Germany especially keep popping up about how they've been innovative about supporting and increasing health versus people just getting sick. I mean, we're talking about preventative medicine, the way they treat cancer. It just goes on, and I just sit here astounded as I talk with guests to say, why aren't we doing this in America? It just blows my mind.
They're laughing at us.
I could believe they would be.
We're dissing their healthcare systems, and we still find people in this country saying, yes, but we have the best healthcare system in the world, don't we? And I would argue that if you have really good insurance, which very few people do, or if you have a lot of expendable money that you can expend to get whatever you need, this is the best place in the world to be. But if you're the average person with average resources, this is really the last place in the world you want to be looking just at health care. It really is.
Right. And a good example of that is many years ago I did this interesting interview about a family that packed up, sold everything they owned, and decided to do a world trip tour. And what was interesting is he was talking about one of his worst fears coming true, and that is having, an accident with one of his kids, whether it was getting sick or breaking an arm, whatever the case was. I think in this case, one of the children had a very serious laceration on the arm, and they were in Korea. So they go to the doctor, and what was interesting is they rush the kid in, they start patching him up, and in the meantime, the father's filling out the form, the basic things, and he was all done, patched up, 20 minutes, that'll be $75. Now, if you were in America, you'd be sitting in the lobby for at least 2 hours, probably. Here's the bill, $300, and that's only once you give permission after a stack of forms to be able to do this, And so I found that just so laughable, but that they actually treat there, where here we have to wait before we can treat.
Indeed, and it's ironic to hear that some of the spin tactics in this current debate has been, accusing other countries of having the waiting lines, when really the waiting is done in this country in a much more severe and irrational way. And we do ration care, but not by who needs it, but by ability to pay, which is probably the most cruel way that could be determined, who gets health care. I myself actually lived in Korea for about a year, and it's remarkable the peace of mind that you have knowing that there's a national health care system in place, and that's something that, in terms of the patient effect of the kind of insecurity that you feel around healthcare in this country, it really makes a difference in terms of the way people think about it changing. And again, if the discussion were about, we want to make sure that you get the necessary care, that you get to go see the doctors that you want to see and go to the hospital that you want to go to, then I think it would be a much different tenor than what we're seeing right now, which is really a debate over how to save the private insurance companies model.
Right.
There is a certain amount of dishonesty or lack of
integrity,
truth in talking about a lot of this stuff. And when President Obama tells people with insurance that they don't have to give up anything, I think that's not true. I think that if clearly, I don't know, clearly is the right word, but if we brought all of these people into our healthcare system and we made sure that everybody was getting the care that they really needed when they needed it, those people with insurance today actually may have to wait a little longer for their elective hernia repair, for their elective arthroscopy, even for their hip replacement. But everybody in this country would get the emergent care and urgent care they needed when they needed it. And everybody in this country would be able to go to bed at night with the confidence that they're not going to go bankrupt from health care costs. And I don't think that's really too much to ask of people. Unfortunately, in this crazy political system we've got, our politicians can't ask anything of us because it'll be twisted and turned by those on the right to say, see, they're going to be rationing health care.
Now, there was a road trip, as I understand. Matt has held doctors to Washington, D.C., and I also understand, Katie, that you're the organizer for Health Care Now. Tell us about these two things, and do you see solutions? Because one of the things I've begun to notice, again, through the course that we've been doing this program, is that we're seeing a mindset change in people themselves about how they take care of themselves, but still, emergency care is a necessary thing that we need to have in place, but you're seeing more and more preventative care on the horizon. But through these two things, Health Care Now and the Matt has held doctors, I looked at the website, do you see a possibility of reform, a good solid reform when it comes to our healthcare system?
Well, as an organizer with Health Care Now, which is a grassroots movement building organization supporting a Medicare for all system, I think that we've come to terms with the need to continue building the public demand to a point where the insurance companies have got to get out of the system, that it's no longer politically feasible to have the private insurance companies controlling our healthcare system. So we do a lot of education. We've done a lot of agitation this year, including a campaign of nonviolent civil disobedience targeting the private insurance companies. We had an openly organized model for people to sign up if they were willing to risk arrest and go directly to speak truth to power in the symbolic target of the private insurance companies that are the problem. And so we had a phenomenal response to that. Over 1,000 people signed up on the website to risk arrest. We had over nearly 40 actions around the country getting media, but yet the national discussion was set to a point where this was outside the parameters of the debate, and it was difficult for us to clearly get through national media that what we're calling for is really Medicare for all, as opposed to just whatever kind of reform is coming through. Paul and his team had an amazing campaign with the Mad as Hell Doctors road trip that I think he should talk about for a few moments as well, his experiences on the road.
Mm-hmm.
Well, our experience, the motivation for the trip was we were just distressed and dismayed at the debate that wasn't happening inside the Beltway, that single payer wasn't even part of the discussion, and the national media wasn't dealing with it at all. So we headed out all the way across the country, stopping in 24 cities along the way, giving presentations and hearing people's stories. And I think we learned more than we taught. And what we learned was our healthcare system is so much more profoundly broken, and the amount of suffering that people are experiencing because of the difficulties with accessing necessary care when they need it, it was very humbling. And at the same time that we were discovering that our healthcare system was broken beyond imagination, we were discovering that our political process was broken beyond imagination. That it's really hard to keep from falling into the depths of despair, but I just don't think we can allow ourselves to do that. We really healthcare is the next civil rights issue of this generation. That for us to be living in what's supposed to be the world's wealthiest country and not having access to healthcare as a human right stated clearly, and designing a healthcare system to reflect that is abominable. Mm-hmm. And people are fired up. People are willing to starting to get arrested for this. And do I think we're going to get anything that resembles definitive healthcare reform from this Congress? No. Mm-hmm. It's just too corrupt. It's too broken. And the Democrats, unfortunately, are maybe a bigger part of the problem than the Republicans right now. But we just need to keep hammering away, and we need to educate people, and we're going to see this. It's just going to take time.
I'd also like to add that there's a chart that shows that in the year 2025, the cost of healthcare consumes the entire cost of amount of individual incomes. So at some point before then, we will have to see meaningful reform, because the uncontained costs are not going to be curbed significantly by this reform, and it's absolutely unsustainable. The system cannot continue. So at some point, meaningful reform will have to be enacted.
This is about politics. This isn't about healthcare. The healthcare argument is so cogent in favor of single payer or some sort of publicly financed, not-for-profit insurance-based system that you just have to say, well, why isn't it happening? And it's not happening for political reasons. Our politicians primarily want to get reelected.
Right.
That's all they care about. The way you get reelected in this political process is you get a lot of industry money in order to finance inane media ads in the next round of elections. And that's what's happening in Washington right now. The industry is investing lobby money in future profits, and they're manipulating public policy so that it's more about profits than public good. It's just that clear.
Now, what can a person listening to this program do today to find themselves actively involved in this process so that we can make the changes that are necessary?
Well, Healthcare Now has a variety of different campaigns running. As we are moving out of this legislative moment, the need to continue to evaluate and educate on real reform is incredibly important. So our website lists contacts all over the country that are affiliated with local coalitions or with organizations working on this issue, and there's an incredible need for people to go out into communities and really be able to, like Paul's group, the Mad as Hell Doctors, and the umbrella group Physicians for a National Health Program, go out and educate about this crisis. So there's a tremendous amount of organizing being done from everywhere from educational forums to demonstrations at insurance companies to lobbying at congressional offices, as well as campaigns that that may be a little more unique, such as the one Healthcare Now is currently working on is to save a young boy, 14 years old, in Kansas City who's currently being denied a heart transplant. He was diagnosed with cardiomyopathy over the summer. The hospital is able to guarantee needed medication to support him, but the transplant centers will not put him on the waiting list until he has $100,000. He's uninsured, and his family doesn't have that money. So doing these sort of human interest campaigns is critical, and telling the story and saying, the reform that's coming through D.C. is not going to help Eduardo Laredo. So our battle continues. But I encourage people to check out the Healthcare Now website, healthcare-now.org. You can sign up for free for updates and action alerts. Something that we all have to embrace and be educated about and bring to our communities as well. There's going to be a lot of initiatives in terms of doctors and others running on single-payer platforms in the upcoming elections. And so this will continue to grow. I think that we are at a point where there's just no looking back.
They call it critical mass, I believe.
Yeah, that's what we're building for.
It's funny because you do say, and I know that this seems to be true when it comes to reform here, is, excuse me, is that it is a political game for officials to be reelected. And I really see a clear solution to this whole thing here that I'm reminded of in the movie Brewster's Millions. And part of what he had to do was spend $30 million in 30 days but have nothing but the shirt on his back that he started with. So one of the things he does to spend this money is he runs for office. However, his campaign platform was simply this: vote for none of the above. It seems that would be a pretty good solution, that we could just start all over.
Yeah, wouldn't that be nice? You could say that this entire discussion is about campaign finance reform, and we're not going to fix anything in this country before we get campaign finance reform. But one of the things people can do is they can educate themselves about health care. There's an emergency doctor that produced a video called Health, Money, and Fear that really goes through very objectively all of the reasons why health care costs so much and why health care is different than selling widgets. And you can see that video at ourailinghealthcare.com. It's available. And actually, that ER doctor is sitting at the table right here with me right now. That would be me.
Very good. Now let's talk about...
The name of the video is Health, Money, and Fear, and if you just Google it, you can find access to... It's also on Blip TV, but it really is very enlightening about what the reasons are that it costs so much.
What's also exciting, too, is I'm finding more and more young people, we're talking in their late teens and 20s, who they begin sometimes approaching me about things they've discovered on the Internet, and it's amazing how incredibly informed they are about all aspects, from the bailout to Wall Street to what we're talking about today. So I see a new rising generation coming up and saying, we're definitely going to change the scape of politics. The old way of doing things just isn't going to work, because to them it just doesn't even seem humane. So I feel very encouraged about that as well. Now, quickly tell us what's on the Mad as Hell Doctors website.
Well, the Mad as Hell, we got back from our trip in early October, and there are some resources that we're trying to figure out what we're going to be doing with Mad as Hell Doctors moving into the future. And we're in the process of making a video about our trip and making an argument that it's really is time to get politically active and to not fall into the depths of despair.
Exactly. The idea is to arm yourself with information so you can make good decisions to do something about whatever it is you want to do something about. It's been a pleasure to have both. Go ahead.
No, that's right.
I was going to say it's been a pleasure to have both of you here on the program. We'd like to invite you back as you see things clearing, obviously, and this is a message that's certainly going to get out. And I'd like to thank you, Dr. Paul Hotchfield and Katie Robbins, for joining us here on the Beyond 50 radio program.
Thank you.
Thank you.
So there it is, folks. It's in your hand. It's time for you to do something about it. So get on there and start doing something. Anything's better than nothing. That's for sure. I'm Daniel Davis. Thank you for tuning in. You've been listening to the Beyond 50 radio program. Also be sure to visit us at our website at beyond50radio.com. Sign up for our free weekly e-newsletter where we have all of these links available for you as well. We want to thank our listeners for also supporting this program, as well as our sponsors, especially ZRT Laboratory. If you're suffering from hot flashes, foggy thinking, sudden weight gain, low libido, mood swings, and other effects of aging, ZRT Laboratory, the forerunner in hormone testing, is your first step toward ending troublesome symptoms. Simply visit them online at zrtlab.com to find out how their home collection kits can help detect and correct hidden hormone imbalances. Let testing be your guide to symptom relief and life-changing solutions that begin with you. Thank you again for tuning in. I'm Daniel Davis. This is the Beyond 50 radio program. Remember, live your day past halfway.